Venetoclax is a small molecule that is targeted against BCL2. Now we know from the preclinical studies as well as other studies that BCL2 plays an important role in the cell survival in myeloma. So the original preclinical studies demonstrated that BCL2 inhibition was a potential therapeutic mechanism in myeloma. Particularly some of the early studies showed that myeloma cells with the T1114 translocation may be particularly sensitive to BCL2 inhibition, since those cells have high levels of BCL2 and low levels of MCL1, which is a resistance factor for BCL2 inhibition. So based on the data, there were two phase 1 studies with dose expansion that were designed. One was a single agent Venetoclax and the other one was Venetoclax with bortezomib. Now the data with the single agent appears to be quite promising. Out of the 66 patients that were enrolled, 30 patients had a 1114 translocation. The overall response rate was 21%, but if you look just at the group of patients with 1114 translocation, it was 40% response rate. If you kind of dive in deeper and look at the 1114 patients and a subgroup of them with the high BCL-XL expression and low MCL1, 8 out of those 9 patients had an overall response. Now interestingly, this was a group of patients with significant prior therapy. The median number of prior lines of therapy was 5, with some patients having as many as 15 prior therapies. Now even in this highly refractory group of patients with single agent Venetoclax, we did see good responses which often were deep, with almost 2/3 of these responses that we saw being VGPR or complete responses. So the result so far is very exciting. The program is moving forward looking at, again, Venetoclax in combination with dexamethasone in the 1114 patients, as well as in combination with bortezomib in all comers with myeloma. And there are a variety of other combinations, including daratumumab combinations, that are being explored. So certainly an exciting agent, especially given the fact that it replicates what we saw preclinically and targets a subgroup of myeloma patients which are defined by a genetic abnormality.